Hi, I'm Dr. Donaldson. I'm one of the comprehensive ophthalmologists at Inland Eye Specialists. Glaucoma is pressure that's too high for the nerves that are inside your eye to withstand. An easy way to think about it is to think if you had a balloon that was lined with a bunch of spaghetti noodles. All those spaghetti noodles leave the back of the eye. Those are the nerves leaving the back of the eye. As that pressure inside that, it'll push on those nerves, kink those nerves as they're leaving, and kill those nerves. The causes of glaucoma are most easily simplified into pressure being built up. So you can think about it like a drain in your tub or in your sink. That drain is going to clog, and you want to lower the pressure in that in the eyeball in this scenario. So all of our surgeries and all of our interventions that we use, whether it's medicine or surgically open up things, is to help that drain function better. If you're curious about glaucoma being hereditary, certain types of glaucoma are hereditary, and there are certain forms of glaucoma that are definitely inherited. However, it's also a multifactorial disease, meaning that there's lots of things that can contribute and add to it. Young people don't usually tend to be affected by glaucoma. However, there are several populations or several groups of people that tend to be at a higher risk. A common question is, how does glaucoma affect my vision? Many people are aware of macular degeneration, which robs your central vision but leaves your peripheral vision or the outside vision intact. Glaucoma, on the other hand, tends to rob the peripheral vision but leaves you with a tight central vision intact. In fact, that central vision is usually the last to go in the most advanced forms of glaucoma. People ask about the symptoms of glaucoma. There's not usually symptoms to glaucoma because your eyeball doesn't have pressure sensors. Similar to your intestines, if you've ever felt bloated, that's because finally you have enough pressure built that sensor triggers, but you don't notice that pressure is building. Glaucoma is the same way. You don't feel glaucoma. Most people will end up being sent to us by their optometrist or by another provider or an ophthalmologist because they see something on exam or they have received a pressure reading that's outside of normal. When this happens, we have to investigate what's causing it and why is that drain not functioning appropriately to allow the fluid to leave the eye. One symptom that sometimes people do have because of glaucoma is if they have pressure that's extremely high in their eye. They will have an eyebrow ache and eyebrow pain, and they'll feel their eye feels like it's bulging. Most people describe a bulging sensation, and they'll be nauseous and to the point of vomiting. However, those people tend to be, although they're an emergency, they also tend to be the people that we can quickly help as well through some pills or even through a small laser operation. Can glaucoma cause blindness? Absolutely it can if it's left untreated and the pressure stays too high. Just like your tub with your sink, if you have a tub that's filling with water and your drain is clogged with hair, if you continue to let the water flow in there, eventually you'll end up with floor damage and damage to the surrounding area. The same thing happens in the eye. So it becomes our job to clean out that blockage as quickly as possible or help assist that blockage through a medicine to clear that blockage. Can glaucoma be cured? The best way for me to describe this is to describe the underlying process. If the pressure in the eye is so high that it pushes on the nerves and kinks them and kills your nerves, we need to lower that pressure. Some people, despite us lowering the pressure to really low numbers, still have damage occurring. And so many people, yes, we are able to cure their glaucoma, but there are a few people that even though we can lower their pressure within their eye, they still may have continual damage even though I see that the pressure is, or I feel that the pressures are adequately low. We treat glaucoma in two ways, medically and surgically. Medically, we're using drops to lower the pressure. Think of it like Drano for a drain. Whereas surgical options, we tend to be scraping the drain open, putting something to bypass the drain, or in an extremely drastic situation, recreating a whole new drain. Glaucoma can be treated by an optometrist, by an ophthalmologist, or even by a glaucoma specialist. Somewhat depends upon the severity of the illness and how much treatment is needed. Many patients are sent to our office because their optometrist doesn't feel comfortable handling their level of glaucoma. I'm happy to treat glaucoma whenever it's sent to me from an optometrist. It's easy to take over care, it's easy to handle the patients, and there's often a lot of things that are still we're still able to do, or stones that are still left to be turned over, and we can improve and help lower the pressure and stay ahead of the insidious process of high pressure in the eye, or the slow burn of losing nerves in the back of the eye. And there are times where I may not be able to slow the burn, and I may need to hand that person over to a glaucoma specialist, or I may need to ask for a glaucoma specialist's help in terms of managing someone's pressure and managing someone's treatment.